Are you considering having bariatric surgery, or are you in the process currently of getting bariatric surgery and you're trying to get approved by insurance and all this stuff? If you are in the right place. Hi there, I'm Angela. I'm a bariatric surgery patient. I just had the vertical sleeve gastrectomy, or the VSG, on March 22nd of 2023, which was about 7-ish weeks ago. In this video, I'm going to be telling you all of the details about pre-op, what that's like, getting everything approved, your pre-op diet, what surgery day actually looks like when you get wheeled back there and you're all alone. We're going to be going over so much stuff today, so be sure to watch. Also, throughout this video, I'm going to be sprinkling in before pictures of what I look like. I'm going to tell you right now, I started at 262 pounds at my highest weight at 5'7". I'm going to be sharing how much weight I've lost in the past 7-ish weeks and just all about this journey. So keep watching. And if you want to see more videos, hit that subscribe button, hit the notification bell. I'm having much more videos about what to pack in your hospital bag, if you need to pack anything at all. Videos about the difference between gastric bypass and VSG and the other types of surgeries. And even a video about food insecurity and how it leads to binge eating and basically how that led to where I am today. So if you want to watch more videos, hit the subscribe button. And also I would love it if you commented on this video about different types of videos that you want to learn about, anything related to bariatric surgery. So let's get started. Now, like I just said, my highest weight, I was at 262 pounds, and that was last year in 2022. And I did lose a little bit of weight before surgery, which I was happy about before surgery day. And I'm going to have a separate video that explains my decision for bariatric surgery and how my childhood led into that decision with food insecurity, with binge eating, which led into adulthood, giving birth. Obviously, when you have babies, you're going to gain weight. Just all of these things accumulated to get me to 262 pounds at one point in my life. And I'm going to have a separate video about that. So for right now, I just want to start about my decision for bariatric surgery and how I even got to the point of wanting it. So bariatric surgery was something that just always crossed my mind. My body image actually started to decline when I was in the 5th grade. I was only 10 years old. And I'll talk about this more in another video, but when I was 10 years old, I started to think that I was fat. And looking back on pictures, I was far from fat, far from it. In reality, I was just the tallest girl in my class. I shot up to 5'7" when I was in the either 6th or 7th grade. I was always the tallest girl in my class up until like the 8th grade when another girl beat me out. So in reality, looking back, I really wasn't that big. It's just because I was so much taller than everybody else, I felt like a giant. I did, which I just said, I'll explain in another video. I had a lot of food insecurity growing up, led to binge eating, led to just so much stuff. And I ballooned up to 262 pounds. And I would lose and gain weight over and over and over again. After my babies were born, I have a son who is 8 and a daughter who is 6. After they were born, I would lose all this weight and get down to 200 pounds. And then a few months goes by, a year goes by, and I was back up another 40 pounds. And then I would go on a diet and lose weight again, and then it would creep back up. It was just this constant roller coaster ride. Bariatric surgery was actually something that was in my mind for a very long time, for years. I don't even know when it started, honestly. I personally know 3 people who have had the VSG done, and all of them lost between 90 to 120 pounds, which was amazing to me. I was like, well, I want to lose 100 pounds at least, like that would just be ideal for me. I talked to them about it a whole lot. It just seemed like something that could happen to me one day. I don't know. So March of 2022, exactly 1 year before my actual surgery date, I happened to be in my doctor's office, and she had been trying to help me with my weight for many, many years. She's never been a doctor to be rude about weight or anything. She honestly comes from a caring place. And at one appointment, she said, "What has happened in your life? Like, what has changed with your diet or exercise or what? You've shot up your 262 pounds. Like, I gotta help you." So she actually put me on diet pills, on phentermine, which I did lose about 30 pounds by taking those. And of course, as soon as you stop taking them, gain all the weight back. We tried injections, just so many different things. Went to a nutritionist for about 9 months, and she was actually really, really great. I really enjoyed seeing her. But it's just my willpower, something about it. I don't know. I would just, like I said, fluctuate back and forth to weight. So in March of 2022, during this doctor's appointment, she said, "Angela, I really think you could be a candidate for bariatric surgery." And I was like, "You really think so?" But I've honestly thought about this for years, but I've never really gone into research about it and what all it would entail and just everything. And she said, "I have so many patients who have had bariatric surgery done, and they have all lost around 100 pounds. She was like, "Sure, some people have a little bit of regain when they're not eating like they should, but they're gaining like 10 or 15 pounds back. You're not gaining the whole 100 pounds back. We talked about what diet would look like. She referred me to the person who ultimately did my surgery. Now, I will say, most surgeries, I believe, are done at a traditional hospital. My surgery was done at a surgery center which specializes in bariatric surgery. So the town that I live next to, the city, it's where I went to college at, it's where I lived for many, many years. It is a medical community. The hospital is a teaching hospital. There's a med school. It's just a very large medical community. So because of that, there's a lot of places that you can go. There you have a few options for bariatric surgery. So I chose a surgery center because the two doctors that started it years ago specialize in bariatric surgery. Now, they do all sorts of surgery from your chest to your pelvis. If you were to have colon cancer and you need to have part of your colon removed or resection or whatever, they can do that. But their specialty is bariatric surgery. I had 2 of those 3 friends that I know that had the VSG done, the vertical sleeve gastrectomy, which is ultimately what I had done. They went to this surgery center also and had these doctors. And so I was confident in my decision that I wanted to go there. Fast forward to September of 2022. So from March to September of 2022, I was still thinking about it. I really don't know why I didn't go see them. I guess just summer break with my kids. I just never had a chance to go. I don't really know what took me so long. But September of 2022, I went to a seminar. Seminar was completely free. It was just an informational. It was like 2 or 3 hours long. It was a long seminar. But you got to meet the 2 doctors that own the practice. You got to ask any and every question. They went over the differences between gastric bypass and the VSG, which is what they offer. They just answered so many questions, went over everything about the pre-op diet, just really made you feel comfortable about the decision. So while I was there, they asked you to fill out a form if you're going to be self-paying, if you want to follow your insurance, all these different questions. They took your weight, they took your height, they did all of this stuff while you were there at this seminar just to get your information. So I knew already beforehand, because I had done research and I already called my insurance and spoken to them, that my insurance actually wasn't going to cover my bariatric surgery, because for my insurance, you had to have a BMI of 40 or above, which my BMI was like 40.1 or 40.3, so barely squeaked by that one. But you also had to have either high blood pressure, diabetes or pre-diabetes. You had to have sleep apnea. It was a whole long list of things that you had to have, like one of those things, not all of it. And I had nothing. I didn't have sleep apnea, didn't have diabetes or pre-diabetes. My blood pressure has always been amazing. Like honestly, I have no other like big, huge issues other than my weight, my BMI. So unfortunately, my insurance didn't cover it, which meant that I had to pay out of pocket. The great thing about the surgery center is that they are a fraction of the price if you were to get it done at a hospital. So I paid significantly less than if you were to go in the hospital, use their operating room. I think they said if you went to a hospital, it would be like $60,000 to $80,000 if you were self-pay. Mine was $12,500. And I'm going to tell you right now, I also have my gallbladder out, which had to come out, which I'll probably do a separate video on, and I had a hernia repaired. So I basically had 3 surgeries in one, which cost $12,500, not $60,000 to $80,000. No. Anyway, while I was there for that appointment in September of 2022, the bariatric coordinator who basically handles all the office stuff, we met one-on-one in her office. And we went over the price list for everything, what everything would cost. And she was the one who set up all of the appointments. Because I didn't have sleep apnea, I didn't have to have a sleep study. Because I didn't have high blood pressure, I didn't have to talk to my doctor about medication or get my heart checked out. I didn't need all of these additional tests that are typically required if you're going through the pre-op process. If you have diabetes or high blood pressure or sleep apnea or something else, you're going to have to go through those tests. That's just a part of life. I, however, did not. What I did have to do was have a swallow test because I had really bad acid reflux, and I think everybody has to do that. That was just basically, you had to drink this really, really fizzy, like the most bubbly, fizziest drink you've ever drank in your entire life. Chug it down as fast as you could and hold in any type of burps or gas and just make sure that it can stay down. That was basically what the swallow test was. And they put you on a table and they tilt you back and they tilt you up and they tilt you sideways. And they're just making sure you don't like burp it up or vomit or whatever. So I had to do that. Also, I had some simple lab work done, which was just, taking blood from your arm. Nothing major. Everybody does. See a nutritionist. That was all I had to do. Saw a nutritionist, which I still see, and which I will see for about a year post-op, I believe. This is my amazing 110 calorie iced coffee. I'm going to share that with you one day. So at this time in my life, yes, I was done with all my pre-op stuff because it just happened just like that. I also had to have a doctor's visit, meet with the surgeon. That was the quick thing. And in that appointment, they had this really cool body scale, which measured your body fat, your BMI, it measured how much water was in your body, it measured all sorts of stuff, and it even gave you a calculation of what you should expect to weigh at the end of the process, about 1 year post-op, what you should weigh. And I got really, really excited when I saw that number. So it's just a really motivating time. Now, that took about a week to do everything because September, I met with everybody. September 7th, I started a new job, and I knew that I wouldn't be able to take off work to go to all of these appointments, to meet with the surgeon, to meet with the nutritionist, to have the swallow test, to have lab work done. So I said, I have 1 week to get all of this done before I start a brand new job. Like, can we do this? And they were like, absolutely. So I got everything done within 1 week. If I wanted to, and if I had the cash money right then, I could have had surgery right then. But obviously didn't have the money saved up, was starting a new job. It just wasn't the right time. So I decided, let's schedule this for December because I knew that I was going to have a week off after Christmas and my kids would be out of school, so I wouldn't have to juggle with them getting back and forth to school. I just thought it would be a really good time. Well, December of 2022, a few weeks before surgery, my what I now know is my gallbladder was starting to act up. I had all of these stomach pains. I had really bad bathroom issues. I would eat and I would just be miserable afterwards, like physical pain in my stomach right after I ate. And it didn't matter if I ate like fried shrimp or chicken, or if I ate a salad or vegetables, like whatever I ate, I was in so much pain. So it took a few months for me to get an ultrasound. I ultimately had to get a CT scan. And it turns out it was my gallbladder, which was inflamed and it was distended and it needed to come out. So before all those tests were ran, in December, I called my surgery center and I said, hey, I'm having all this abdominal pain. I'm not sure what it is. I'm currently going to the doctor to figure it out. Let's postpone this surgery. Well, it was such a blessing from God himself, because the week of Christmas, my husband went to the hospital and it turns out he had a stroke. And so that week where I had off for Christmas break, where I was supposed to be recovering for surgery, was a week where he was home and I was helping take care of him and the kids and the house and everything. And so it was such a blessing in disguise that I actually had this abdominal pain, because if I didn't, I probably would have had the surgery. There would have been no reason to postpone it. So it was just this amazing God thing that happened. So also during that time, I still had to save up some more money. We had some money in savings, but I just wanted to save more, just to be comfortable with it. And so fast forward a few months and I scheduled the appointment for May 22nd of 2023 for my VSG surgery. So even though I've been talking about it with my doctor since the previous March for an entire year, it really only took 1 week to do all the pre-op appointments. And that was it. I could have had it done at any time since I was self-pay. Now, if you're using insurance, it takes a long span of time. Some insurance carriers, whether you have like Blue Cross and Blue Shield or Aetna or whatever you may have, some say you have to go to nutritionist appointments every single month for 6 months, or every single month for a whole year. Or your doctor has to have documentation of your failed diet and exercise attempts. So many different insurance carriers have different requirements, and it's not consistent throughout carriers. So you just have to trust the process. Call your insurance company before you meet pre-op and maybe find out what you need to get done before you even meet with the surgeon. That way it can save you a little bit of time if you're questioning that. So I had the VSG surgery, the vertical sleeve gastrectomy, on March 22nd. Basically what that is, if you don't know, I'm going to have a separate video about the difference between gastric bypass, which is typically what people say when they have bariatric surgery, and the VSG. Basically, the short version is that the gastric bypass reroutes some of your organs and your stomach stays intact, whereas the VSG, the vertical sleeve gastrectomy, they remove about 80% of your stomach. And so your stomach, I was told by the nutritionist, when you come out of surgery, you're trying to find a highlighter. This is just a pen. Your stomach is the size of a small, skinny highlighter. I cannot imagine that. And over time, within the next year or so, it's going to stretch out and it's going to be a little bit bigger than this. Maybe like the size of 2 pens or 2 highlighters, but it's extremely, extremely small. It is 80% of the size of a typical stomach. And so what that causes is food restriction. And so obviously when you can't eat more than a few bites of something, you're just naturally going to lose weight because you're not getting in as many calories. So let's talk about surgery day and what that's like. So no, rewind. So let's talk about the pre-op diet and what that's like. Now, I have heard and seen so many stories about people who have all sorts of pre-op diets. A pre-op diet is typically 2 weeks before your surgery date a specific diet that you follow per your surgeon or your nutritionist guidelines. You can follow me on Instagram at bariatric_Ange. It's the same handle as my YouTube channel. And on Instagram, I have come across many, many people who have all sorts of pre-op diets. Mine was for 2 weeks. Most commonly, it's for 2 weeks. Some people's, it lasts for an entire month before surgery that you're on this special diet. Some people have an all liquid diet where all they have for 2 weeks or even a month is just liquids. It's just protein drinks or clear jello, ew, or chicken broth, things like that. Mine, thank you, Jesus, was just 2 weeks of a low carb diet. So my diet consisted of staying under 40 grams of carbs a day. There was no calorie counting to do. It was just stay under your 40 carbs. So for example, I could still have a grilled chicken sandwich, just take off the bun and just have the piece of grilled chicken with the lettuce on top, or bacon or cheese or whatever you want it. And just couldn't have like pasta or rice or anything like that. But other than that, those 2 weeks was relatively easy to do for me. I did have a few protein shakes just because I enjoy protein shakes. For years, I've had either my own protein shakes with my protein powder, or I've used like Fairlife shakes or Premier protein shakes. I'm just a fan of them. And so it was really easy for me to follow this 2-week diet. And I will say, even though my highest weight was 262 pounds back in 2021 and 2022, when I went to the doctor to get weighed, I was 254 pounds back in September of 2022, and I kept that weight with me until March. My weight always fluctuates a lot, but I was around 254 at the pre-op diet. When I went in for surgery 2 weeks later, I was 248 pounds. So I lost 6 pounds on the pre-op diet. Now, the people who were on all liquids for those 2 weeks, and especially for an entire month, those people are losing like 20 pounds in 2 weeks or a month because they're only consuming liquids. They're not consuming anything else. No, like chicken, like protein and vegetables, like nothing like that. So those are the people who are dropping massive amounts of weight in the pre-op diet. So if you aren't losing a lot of weight, I mean, I lost 6 pounds in 2 weeks, which I personally think is great. But even if you lose 1 or 2 pounds, don't get discouraged. It's just everybody's on a different diet depending on your doctor. So don't get discouraged. So the pre-op diet lasted for 2 weeks. Fast forward, March 22nd, came out of nowhere. And yes, I worked up until the day before my surgery. My first day out of work was on March 22nd, the day of my surgery. So I showed up at my surgery center. My husband and my mother-in-law took me to the surgery center. We went there. When I walked in, the person, she was like the surgery center coordinator type person. She gave me a big hug because I actually know her. We used to go to church with her years and years ago when we lived in a different city. And so to see a familiar face was so comforting to me. I loved that. So we sat in the waiting room just for a few minutes, and then they called me back maybe within 5 minutes later. They took my weight. I was 248 pounds. Because like I said, I lost 6 pounds during the pre-op diet. So I was 248 pounds on surgery day. The nurses that I had 2 nurses to myself. And because it's a surgery center, it's not like you have 10, 15 patients or you have like a limited amount of nurses or anything. There was one other patient that was before me, and then there was myself. They had 2 patients for the entire day. I had 2 nurses completely to myself once that other patient left. Had the surgeon, obviously. Lots of other staff was there. I was very, very well taken care of. One thing that I'm so thankful for, I had constant supervision while I was there. So before surgery, the nurses went over my medication list like 3 times because one of the things that you have to do, non-negotiable, is for the first 6 months after surgery, and it might change depending on your doctor again. But for me, the first 6 months after surgery, I cannot swallow any pills. And so any medicines that I take has to be chewable, crushable, or in a liquid form. Now, I'm gonna tell you right now, I deal with some mental health issues, so I take different types of medication. So it was especially important that I still took my medicine because I'm not just gonna stop taking it. But they made sure, they triple checked that I had liquid forms of my medicine, chewable or crushable forms. They just checked everything out. So they went over my medication list. They also started the IV just to get some stuff started in me, and just explained the process. I met with the surgeon. He was like, you're gonna be taken care of. During this time, my husband was back there with me. I also changed into my gown and my cute little socks that they give you, the non-slip socks. And my husband was back there. He took some pictures of me, like before pictures. I was just so excited to have it done. The day was finally there. I was honestly like 2% nervous. The rest of me was just so happy that the day was finally there. And I just knew that from a weight standpoint, that my life was about to change, that I was, not that like your weight should change your life drastically, but all the positive changes that were going to happen, like that I was going to have more self-confidence and that I would be able to get down the floor and play with my kids more instead of like complaining about my knees, or be able to walk around Busch Gardens without getting so heavily out of breath by climbing all of the steps that they have. I was just excited for those type of positive changes and that how my life is going to change in that way. So I was just really excited for the surgery day to finally be there. I met with an anesthesiologist. He explained all of the medicine that he was going to give me. I think he said they give the average patient between 12 and 15 medications, because I learned there is not one medicine that puts you to sleep when you have surgery. There is a boatload of medicines because each medicine works on a different part of your brain to make it go to sleep and then also to make it stay asleep so you don't wake up no matter what. They also give you like 3 or 4 different anti-nausea medications. They just really do pump you up. And of course, fluids, like just so your body stays hydrated. They just pump you up with so much stuff, which is just wild to think about. Before I knew it, my husband had to go back into the waiting room and they wheeled me back to the operating table. When I say this operating table looks like it's about that skinny, I'm not lying. It is so narrow. And I've had surgeries before in the past and I've never remembered going like into an operating table, but all my other surgeries have been in a hospital. So I was already put to sleep and then I guess somebody just transferred me over to one of those tables. But this time I wasn't put to sleep yet. They transferred me from the hospital bed. I had to scoop my cute little butt over to the operating table itself. It was like that skinny. I thought I was gonna fall off. They made you put your arms completely out sideways. They strap down your arms, I'm assuming so that when you're in surgery, if something happens, your arms don't flail out. I think they said that some people have like natural reflexes where their arms might go up and down or something. So they just restrain you so that nothing happens. Not sure if they restrain your legs. I wasn't awake for that part, but the anesthesiologist said, okay, I'm about to give you some good stuff. And he said, count backwards from 10. And I made it to the number 9. I went 10, 9, and I was out. Next thing you know, I was awake and I was in the recovery room. Now, at my surgery center, they had strict guidelines for you to be able to go home. And this surprises a lot of people. I went home the same day that I had my surgery. Following all these people on Instagram that I do, virtually everybody stays overnight, at least one night. I follow one person who's in the UK, and they keep you in the hospital for an entire week. So everybody is shocked when they hear that I went home the same day as my surgery, but it's true. I went home the same day. So I woke up. I remember I was still groggy, but I remember the surgeon came in and talked to my husband, who was in the recovery room with me, and I had a hernia. It was this certain type of hernia where part of your stomach bulges into your esophagus, and it can cause a ton of acid reflux and all sorts of problems, which was the problems that I was having. And so he said that bulge, about this much of my stomach, was going into my esophagus. No wonder I had such horrible acid reflux for years and years and years. Like, it was a hernia that was causing all of this. So that was wild to think about. So he explained the surgery, said everything went really well. The nurses came in, and it turns out one of the nurses, surprise, she goes to my church. And we have a fairly large church. And so I actually saw her at a function a few weeks later, and I was like, hey, you were my nurse. And so we talk randomly whenever I see her on Sundays. So it's just fun, just that, like, she was a really, really good nurse, and now I get to see her at church every week. Like, I think that's pretty cool. Anyway, so the nurse was like, do you feel up to walking? And I was like, sure. So I went for a very short walk down the hallway. I really only had one incision that hurt. In this procedure, I was not cut open, like a line across my stomach. That really is not done anymore that I know of. So it's done laparoscopically. So you have, if you've had laparoscopic surgery before, you may already know this, but if not, I will explain it to you. You basically have these things, I cannot remember what they're called. It's not a probe, but it's something else, but it's these long instruments. And you have one that goes right beneath your chest area, around your rib cage. I think they're called trocars. I could be wrong. Somebody Google that for me. And then you have 4 more typically that go around your abdomen. And so you'll have 4, 5, 6 tiny little scars, like that tiny. They're super, super tiny. All of my surgeries in the past have always been laparoscopic. Like when I had my appendix out 10 years ago, that was emergency surgery. That was done laparoscopically. It's just like the standard now. So I only had one spot on my abdomen that hurt, and it was very, very painful. And so I got up and I walked around a little bit, had to go to the bathroom because they pump you up with all those fluids, and also the pain medicine is obviously in a fluid form because it's in an IV, the nausea medicine, all of that. I had to pee and pee and pee and pee and pee. It was like nonstop. While I was in the bathroom, my nurse said, do you want to brush your teeth? They actually had a toothbrush and toothpaste waiting for me. At that time, I was very nauseous still. I was still very, very groggy. I mean, while I was sitting there, she was like, don't close your eyes because you might fall over. So I had to make sure that I kept my eyes open. I mean, I was just still very out of it. So she asked me if I wanted to brush my teeth, and I was like, I'll do that in a little bit, not right now. So I went back to lay down. My chest was on fire. When I say it hurt, I mean it hurt. My whole chest hurt all the way up to my left shoulder. And what that was, it was a combination of the gas pain, because when you have laparoscopic surgery, they basically fill up your abdominal cavity with tons of gas. And that is so that everything expands and they can see every single organ clearly. Because if not, when you look inside your body, everything's like mushed together. But when you put gas in there, it all expands and kind of separates so they can like look at every single organ individually. Very fascinating. So because of that, gas can get trapped in your body, and it typically goes up to your chest and your shoulders. Like I've said, I've had laparoscopic surgeries before. I have never experienced gas pain before though. Let me tell you, it is horrendous. It is terrible. They also said part of the chest pain that I was having right here, deep stabbing. It felt like I've never been stabbed with a knife, obviously, but it felt like that's what it should feel like. I felt like my chest was being stabbed with a knife. It was so painful. And so that actually took a few days to go away. They said this is normal, but it is going to hurt. And they reassured me after 72 hours, I'm going to feel like a completely different person, which I did. So after a few minutes, I was so uncomfortable. It also radiated towards my upper back. It was just a combination of the gas pain, the chest pain. It hurt so terribly bad. I had like 4 pillows behind my back. It was extremely uncomfortable. Nothing was helping me. So I was just like, can I walk around some more? And so I would walk around some more. Walking around makes you tired and you're still out of it. You feel like you're going to fall over. So it was like, can I sit down again? Then when you go sit on the edge of the bed, you're like, I think I'm going to lay down and put pillows behind my back. And then when you do that, you're like, I think I want to walk again. It was just such an uncomfortable time. And I just wanted to be in my bed so badly. So another thing that you have to do is you have to be able to keep down your protein shake. So they asked me what I wanted, what flavor I wanted. They happen to have the Premier Protein brand of protein shakes in chocolate flavor. So that's what I got. I was able to keep it down while I was at the while I was at the surgery center. I was still very nauseous, but I was able to keep it down. I also had like this breathing machine type thingy, like a little handheld device that you just breathe. I would breathe in. Some people breathe out, but I was told to breathe in and also break up the junk that's in your chest from surgery and help with the pain, which it did help. So I had to make sure that I was breathing fully, I could keep down my protein shake, and that I could walk around. And so I was able to do all those things, and they keep you there for a minimum of 2 hours. And you also have to be able to keep down water, which I was able to keep down. So after that, they said, do you want to go home? And I was like, I just want to be in my own bed. Yes. I passed all the tests. I was able to go home. I'm still confident in my decision. I'm glad that I went home right then, because as soon as I got home and got in my bed, I was out. That was the most comfiest bed I've ever slept on, is my own bed after surgery. It was so comforting to me. So, however, as soon as I got in the car, I don't know if it was because it was a kind of a hot car and it was bumpy rides. I had to go over railroad tracks. I mean, I started dry heaving. I wasn't throwing up yet, but I started dry heaving over and over and over again, basically the whole ride home. I was miserable. And when I did get home, I was throwing up more. And so a few factors came into play. Pain medicine can make people nauseous, and I was still on the pain medicine. I didn't have any of that anti-nausea medicine still in me. They did send me home with some Zofran that I could take for nausea, which I took, and there were the disintegrating tablets. So you just put it under your tongue and it dissolves. So I did have that. But what we really think it was the Premier Protein shakes that were making me sick. And so I noticed a pattern of that I would drink 2 ounces of the protein shake, and then a few minutes later, I would throw it up. And this wasn't just dry heaving, it was actually throwing up everything that was inside of me. And so my husband was a smart one, and he said, I think this is too thick for you, because Premier Protein, if you haven't had it before, it is a very thick shake. Fairlife shakes are very thin, kind of watered down as far as a protein shake goes. So I tried that and I never got sick again. Like, it was the Premier Protein shakes that were making me throw up, making me nauseous, and it was just too much for my fresh little highlighter size baby stomach. It was just too much for me. So I switched to Fairlife. I had no issues since then. So basically the first 72 hours, the first 3 days, I slept a ton. And I took my pain medicine as needed, and I took the Zofran as needed for nausea, because I was still getting nauseous. And that's not just with the protein shakes, just after surgery. You're probably going to be nauseous and getting used to your new stomach. But after 72 hours, I noticed a huge difference in the gas pain in my shoulder and in my chest. It still hurt a whole lot, but it drastically went down. The pain was actually manageable. I was able to use a heating pad and I could tell a difference. I was able to move my shoulder a little bit up and down, because before that, the first 3 days, I couldn't even move my shoulder. It was so extremely painful. So the first 72 hours went by and I got so much better. After about, I'd say a week, about 6-7 days, my chest pain and my shoulder pain finally went away. It was about a week because I saw my doctor a week post-op. Also during this time, the first few days, I broke out into a really bad rash on my abdomen where all my incisions are, and I'm going to do a separate video on that. But basically, I was allergic to the surgical glue that they use or the Band-Aids. Something was happening, and I had an allergic reaction to it. Like I said, that'll be in a separate video for you guys. And I'm also going to do a separate video about the post-op diet and what that looks like, because for the first few weeks after surgery, you can only have, you guessed it, liquids in the form of protein shakes. So I'm going to do a separate video about that and how I transitioned into pureed foods and the soft foods and regular diet as well. So what you've all been waiting for is how much weight have I lost? So let's do a recap. My highest weight in 2021 and 2022, I was 262 pounds. At the beginning of the pre-op diet, when I saw the surgeon last year, I was 254 pounds. And after the pre-op diet, I lost 6 pounds. I was down to 248. So on surgery day, I was 248 pounds on March 22nd of 2023. Now, almost 7 weeks later, I have not weighed myself since 6 weeks post-op, so it may be slightly different by a pound or two. But as of 6 weeks post-op, I'm down to 226 pounds. I've lost 22 pounds in 6 weeks. This is amazing. I feel amazing. I'm going to throw up some pictures. I can feel it. I can really see it in my face. My face used to be like out to there, no lie. And now it's like slimmed down. I can really tell in pictures. And also my dimple is coming back on my cheek, because once you get bigger, your dimples kind of go away. And so now that's coming back, and I'm just so excited because I think it's really cute and I love that about myself. So yeah, I lost 22 pounds in 6 weeks. I'm so thankful for this tool, for this surgery. Like I said, I'm going to do lots of other videos. Please leave a comment if you have any ideas of what I should film about, of any questions that you may have that I didn't answer about pre-op or about the surgery itself. If you have any questions at all, just let me know. And I look forward to seeing you in the next video. Bye.